my presentation is on, in fact, what is the social norm about the social norm approach. And that social norm might be that it is always about alcohol and drug prevention, and then mainly in students. But that's a misperception, and this misperception should be corrected. Because I did a small literature search, and this is what I found. SNA is also about all these things, for instance, and there are 3 points at the end, so there's still more to explore. I have only 15 minutes for this presentation, but it will be, as I understood, it will be available afterwards for the participants and other people. So that's why I also included the references. So if you are interested in one of these topics, you can find all the references. And I also have some other topics referenced referred to at the end of the presentation. So, yeah, Sun Valley, Valley of the Sun. It's a Phoenix in the United States. And it's a study on sun protection with using the SNA. And you see, it's not on students, but it's for sun bathers. And I'm just going to the conclusion. They found, the Reed and colleagues found that the present research demonstrates the utility of correcting injunctive norm misperceptions for promoting healthy behaviors and attitudes changed in response to personalized normative feedback. Another one is with a target group of hotel guests, environmental conservation in hotels, from Goldstein and colleagues. And they conclude that the appeals employing descriptive norms, for instance, the majority of guests reuse their towels, proved superior to a traditional appeal widely used by hotels that focus solely on environmental protection. Moreover, normative appeals were most effective when describing group behavior that occurred in the setting that most closely matched individuals' immediate situational circumstances. And that's what we already saw this morning, that the closer it is to the individual persons, the reference group, the better it works. And so the majority of guests in this room reuse their towels. So it's important that it is stated there in this room, because then it's very close to the target group. Okay, then.
You can also have a look here if you want to.
Oh yeah,
that's
okay,
better for you.
yeah, maybe that's easier.
Yeah.
Okay, yeah. So another one on hotel guests, which in fact came to similar results from Schultz and colleagues. And I also read only the conclusion. The process of normative social influence extends to a relatively private behavior in the hotel room and can be invoked through print messages. We are close to posters here, but it seemed to work in that study. And our findings show that posting printed normative messages in hotel rooms produced a significant increase in the number of towels reused by hotel guests. So it also worked in this study. And this effect occurred without social interaction. People are in their hotel room. The behavior occurred in the privacy of one's hotel room, and the normative information was simply presented on a printed card. So this is also another example that SNA is often also very simple. Then what they also found, and I go to the part in red, our results, they say, did not show the normative information about a specific referent group. Although we oftentimes and mostly say that it is important that you have the correct referent group, but in this study that was not even the case. It was not more influential than a generic norm message, which makes it even more simple again. Yeah. Okay. Students, yeah, these are students as a target group. I'm sorry about that, but it's on a really recent topic, COVID-19. Yeah, you cannot mention or you cannot give a presentation nowadays without mentioning COVID-19, of course. And it was in Massachusetts, the Brandeis University, where they did a survey in students to find out their attitudes, beliefs and behavioral intent regarding COVID-19 safety guidelines. And they concluded that the survey identified a misperception of the social norm. So that's to start with the most important thing when you want to come to an intervention afterwards. While the majority of students reported strong support for COVID-19 safety guidelines, they were less likely to believe that other students supported these measures. And then they developed also posters, a lot of posters, I must say. And you see here that for all the actions, the preventive actions regarding COVID-19, a very high percentage of students agreed with these. So hand washing, wearing a mask, keeping distance, and so on. These are indeed very simple messages that can have a lot of impact. It's just as an example that I give these posters. And then another target group, smartphone users. An article of John McElhaney, a common friend, colleague of Christiana and me. And they did a study in which they demonstrated the potential for applying the social norms approach to empower individuals to take greater control of their smartphone use. And what is interesting also in this study is that the actual smartphone behavior was recorded by an app, because that's something that you often hear about social norms approach, that the data that are collected are maybe influenced by social desirable answers. But here they had the actual smartphone behavior. So it was very clear and clear-cut that it could be compared with the self-reported behavior. So that could also give an accurate difference between self-reported estimations and the actual smartphone use. So I'm going to skip this slide. This is, for instance, what the result was. Some of the results. You thought you checked your smartphone 40 times each day, but you actually check your smartphone 83 times each day. And then it was asked, how do you feel about that? Another example, you thought that other people check their smartphone 90 times a day, and that was overestimated because the app, it was called Space, the app, users actually check their smartphones 61 times per day. So again, this is a very nice study with an actual smartphone use. Okay, let's see. Diet. And here we have as a target group the school pupils. A study by Lely and colleagues. Conclusion, respondents overestimated their peers' intake of snacks, and they also quantified it. So they overestimated the intake of snacks by 1.8 portions a week, sugar-sweetened drinks by 5.2 portions, and overestimated how positive their peers' attitudes were towards these behaviors. They underestimated their peers' consumption of fruits and vegetables, the healthy behavior, by 3.2 portions per week, and how positive their peers' attitudes were towards fruit and vegetables. So a lot of data that can again be used, it could be used and that were used to develop a social norms approach intervention. And so that's what they did. They corrected the misperceptions, and they have the potential to improve adolescents' diets, which is also an important part of health promotion when you have a healthy diet, of course. I also give the examples, but I'm not going into detail on that. So how they exactly ask the questions. You can read it afterwards when you have the PowerPoint. And then hand washing. And there the target group is students on the one hand, and on the other hand males using men's public restrooms. I must say that this is a very complex study of Lapinski and colleagues, so I'm not going into detail what the methodology is concerned. But you have it there again if you want to read it afterwards. And I'm going to the results immediately. And again here, the results indicated that hand washing behavior is appropriate for health promotion through normative influence. Again, also for this topic, it's possible to use the social norms approach. And yeah, they had, in fact, 2 studies. And the second study also concluded that messages increased hand washing frequency, the length of time water was run, and attitudes relative to control. And what is also interesting is in red, but I will first read the overall result. The attitudinal and hand washing frequency data suggest that the high prevalence messages they used in the study were effective, but that the presence or absence of others had little influence on behaviors. And what they did, it's in very small font, but I will read it. It's a very specific and special experiment they did. They had someone in the restrooms, and that person was simulating. They simulated the public behavioral privacy condition, and there was a man in the restrooms who pretended to be scrubbing a stain out of his shirt while standing away from the sink. And they say, yeah, it didn't have an impact when that person was present on the hand washing behavior. Perhaps, they say, because he appeared to be preoccupied, participants did not feel that their behavior was being scrutinized, thereby reducing the effect of the privacy manipulation. But it's also, I think, a nice way to try to simulate that you are not alone in a restroom. Yeah, hand washing, of course, we have to thank Ingra's Semmelweis from long ago, but that's another story. Okay, Americans are the target group in this study of Sparks and colleagues on climate change, and the experiment was that they had a YouTube video about climate change using 2 experimental conditions, one providing a small number of views under the video, and the second listing a large number of views. And again, they concluded that it seems to work. The number of views Q did influence participant perceptions of the importance assigned by other Americans to the issue of climate change. If such cues are sufficiently strong and recurring, they may also serve as effective catalysts for behavior change. So even a very important topic as climate change can be part of a social norms approach campaign. And then something we did ourselves, riding along with the driver who is under the influence of alcohol or drugs. And the target group here were young people, because a lot of interventions are focused on driving yourself under the influence. But we also thought that it could be interesting not to ride along with the driver who is under the influence of alcohol or drugs. And we had a study in almost 1,300 adolescents who completed the questionnaire after an invitation by email or other social media. Facebook, Twitter, for instance, and we found that 90% stated that it is sensible to refuse to ride along with a driver who has been drinking alcohol. And yeah, oh yeah, I will make it. Yeah. And this is a beer mat that we used to put the message on. So it's in Dutch, but I also saw that Christiana had messages in Danish. So it says that 90% of the passengers doesn't drive along a driver which is under the influence. And also the source is mentioned, how we gathered the data. So it's printed on a beer mat. And then a last one that we did ourselves in primary school, children, so children from 9 to 11 years. We did a survey on feeling, doing and thinking regarding well-being and health in primary school children, and we called it So Could It Be Happiness? And we also measured happiness. It was measured looking from the so-called remembering self. It's a retrospective view. And this is happiness yesterday, and you see there are a lot of pupils that score very high, but also several pupils that score very low. And we tried, it was just an experiment, it's not really developed well at this moment, but we think it should be possible also to have happiness as a target for social norms approach. For instance, you see here the two bars on the left side. These are pupils that score their own happiness very high, 9 or 10 on 10, a scale of 10. And on the right side you see the pupils who score their own happiness lower, 1 to 8 on the scale of 10. And the red part is those pupils that overestimated the happiness of the other pupils. And you see that that part is larger in the group that scores their own happiness much higher. So maybe already the data indicate that it might be possible to do something with the social norms approach regarding happiness. And we also asked regarding the happiness of the teacher. And this is the graph for the girls. The girls who score their own happiness very high, they also overestimate the happiness of the teacher compared to those who score their own happiness lower. These are the girls and these are the boys. The difference here is a little bit smaller for the boys. But again, you see that when the male pupils score their own happiness higher, they also overestimate the happiness of the teacher more than when they score their own happiness lower. So maybe it's something for the future that we can also try to do, because we are still in a phase that we can try a lot to do with the social norms approach. We are not at the end yet of what we can do with it. And you see there are also some other topics which I didn't mention in detail, the peer study, habit use, problem gaming, health behaviors and college engagement, risky sexual behavior and alcohol-related risky sexual behavior, motivating saving behavior. So still a lot of work to do and a lot of possibilities for the SNA. Okay, that's all. Thank you very much.
Thank you so much. Thank you, Guido, for your explanation to broaden our mind in where SNA can be applied. 2 questions came in. Very interesting how it is in most of the times differ the actual use and the perceived use. Doesn't that mean that we always should use the SNA approach?
Of course.
Of course.
Of course. Yeah. But it's a very good question, because when you do not find an overestimation, then it doesn't work.
Ah, okay.
But mostly you find an overestimation. So that's something in our brains that that tells us that we have to overestimate the unhealthy behavior of others.
Yeah.
So most of the time it will work. Yeah?
So can you maybe say a little bit more, because that was what I'm thinking about. You know, what does it say about us as human beings that SNA works?
Yes, we discussed it earlier this morning between us at the table here. In the video that was shown, the first video, a lot of people said we do not believe the real norm, the actual norm.
Exactly.
And that's because our brain is very effective in what we see is what we get. So we see, for instance, students drinking a lot on the street. And we cannot imagine that most of the students are studying in their room. So, and that's a problem. The problem. It's nice that it is the case because we can use the social norms approach then. But that's what our brain is doing.
Right.
It's what we see. We think that's the truth. That's the real life. And what we not see, it's difficult to see or to know. Or to understand that most of the other students are studying, but we don't see them.
No, because they're not in your in your neighborhood at that moment when you're drinking. Okay. Last question or remark: happiness data. : false consensus effect. I don't know if it's a statement or a question, which might be a general problem in SNA. That's what Nanne de Vries is saying. Do you understand what he means?
The false consensus concept. I don't really understand what is meant here.
Maybe
you know. No.
It might be about the concept of happiness. Maybe people understand it differently. That might be the question. I don't know.
Okay.
Can you hear me?
Nanne de Vries, are you here?
I am, of course.
Can you
The false
explain your
consensus
question?
effect
Yeah.
is the overestimation of the prevalence of your own opinions and behaviors. That's in social psychology, that's called the false consensus effect. And that's what I saw in the happiness data, which might be sort of an issue in any approach in social norms, because we tend to overestimate the popularity of our own behaviors, opinions, etc., etc. So that's what I try to say here. And the same, there was just a referral to a thing that is called confirmation bias in social psychology as well, which is again looking for proof of the things that you assume to be true.
But still, I think when we see the results of a lot of studies working with SNA, it still seems to work, despite maybe of the confirmation bias. And maybe then it's also good to have actual data like they had with the smartphone app